Hi everyone. In today's clip, I will talk a little bit about prostate issues. Just a reminder that anything I post here is not meant to cure or diagnose anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, the prostate is a walnut-shaped gland that is a part of a man's sex organs, which also includes the penis, scrotum, and the testicles. The prostate makes fluid that goes into semen, which is a mix of sperm and prostate fluid. Prostate fluid is important for a man's ability to father children. The prostate is in front of rectum and just below the bladder. The gland surrounds the urethra at the neck of the bladder. The bladder neck is the area where the urethra joins the bladder. The urethra is the tube that carries urine from the bladder to the outside of the body. In men, the urethra also carries semen out through the penis during sexual climax or ejaculation. The bladder and urethra are parts of the lower urinary tract. So urine and semen flowing through the urethra pass through the prostate. The normal causes of prostate problems may be prostatitis or benign prostatic hyperplasia, or BPH for short. So the doctor may not always know the exact cause of the prostate problem. The cause of prostatitis depends on whether you have chronic prostatitis or bacterial prostatitis. We have chronic prostatitis, as I mentioned, and the doctors don't know the exact cause of this, and researchers think that an infection of tiny organisms, although not bacteria, can cause chronic prostatitis. Other causes may include chemicals in the urine, the body's response to a previous urinary tract infection or UTI, or nerve damage in the pelvic area. Most of the time, doctors don't find any infection in men with chronic prostatitis. Then we have bacterial prostatitis, which bacteria can be the cause of infection. We also have benign prostatic hyperplasia or BPH, and again, doctors don't know the exact cause of BPH, and the changes in male hormone levels in older men, aging, inflammation, and fibrosis can play a role in causing BPH. Fibrosis is when extra tissue forms around the organs and becomes thick and stiff. So any man really can develop a prostate problem, and prostatitis can affect men of all ages. However, it is most common prostate problem in men younger than age 50. BPH is most common prostate problem in men older than age 50. Men younger than age 40 rarely have BPH symptoms. Other factors that increase the chances of BPH may include certain medical conditions and lifestyle choices. The symptoms of a prostate problem include problems with urinating and bladder control, and bladder control is how well they can delay, start, or stop urination. These problems can cause them sort of to go to bathroom quite frequently, feel as if they need to rush to the bathroom, only to find that they cannot urinate, or they urinate only a little, leak or dribble urine, or have weak urine stream. If prostatitis becomes chronic, the symptoms may cause long-lasting pain and discomfort in penis or scrotum, the area between scrotum and anus, in belly, and in lower back, and the symptoms may sort of come on quickly or may come slowly and last long. The patient also may have fever, chills, or body aches. If they have BPH, they may need to wake up often to urinate, and their urine may have an unusual color or smell, and they may also have pain while urinating or after ejaculation. The doctor can do any of the following sort of to find out if the person has prostate problems. They can do a physical exam, including a digital rectal exam of the prostate. They can test on urine, blood, on lower urinary tract, ultrasound, or prostate biopsy even. So in the case of chronic prostatitis, the doctor will try treatments to lessen pain, discomfort, and inflammation. They may sort of prescribe alpha blockers to relax the muscles in the prostate and part of the bladder. Tamsulosin and silodosin are two commonly used alpha blockers. Also, warm baths, relaxation, exercise, and physical therapy also can help. In case of bacterial prostatitis, the doctor prescribes usually antibiotics to kill the bacteria. As a part of the treatment, the doctor may also ask for a change of diet and increasing the liquid intake. For BPH, they normally go the route of watchful waiting, lifestyle changes, medications, and perhaps sort of like surgery if the prostate keeps growing and the symptoms are worsened. In some cases, the doctors may even recommend removing the prostate. If the doctor removes the prostate, the person is more likely to have a long-lasting problem with bladder control or having sex. So, of course, diet and nutrition play a major role in prevention. A side note is that since at least the 1700s, Native Americans in what we now know as the southeastern sort of United States used fruit of saw palmetto to treat male urinary problems. In April of 1879, Dr. J.B. Reed of Savannah, Georgia, published the medical uses of the saw palmetto, including the treatment of prostate enlargement, in the American Journal of Pharmacy. So a tea made from saw palmetto berries was commonly used to treat this condition and urinary tract infections. Saw palmetto, along with pumpkin seeds and dandelion root, continued to be used actually for these purposes through the 1940s. So various extracts of saw palmetto berries and the berries themselves remain available without a prescription even today. So extracts from the berries of the saw palmetto are still used in 50% of BPH treatment plans in Italy and 90% of BPH treatment plans in Germany. So doses typically involves 160 milligram twice a day or 320 milligrams once a day. Doses up to 480 milligrams a day have been shown to be safe. Whole berry doses of 1 to 2 grams a day have also been studied with favorable results. So those considering a saw palmetto supplementation, though, need to check the label for indications of standardized content with 85% to 95% fatty acids and sterols. Emotionally speaking, chronic stress and unresolved emotional issues can manifest in physical symptoms, and prostate is no exception. When it comes to prostate health, emotions often run deep and complex. Fear and anxiety are frequent companions on this journey. And then there is shame and subtle emotions that often go unspoken but feel all too real. So prostate issues can happen as a result of a professional failure or after retirement, especially for those who live their profession with passion and for whom work is the only thing that gives meaning to their lives. Similarly, after a serious conflict in which their image as a man, as a parent or grandparent has been damaged. Like the case of, let's say, a father who suffers a great disappointment to see that his child walks along a different path in life to that he expected or he entered, and the for example, they're following, let's say, the line of use of drugs, or they're going into, or they're homosexual or lesbian, and this is something that the father doesn't accept. So other issues, such as when a man is separated suddenly from their grandchildren, or when they think they will never be able to have grandchildren, etc., or when the bride, let's say, dumps them for a younger man, right? So those with this issue have to understand that their value is not in that to which have been delivered, like profession, position, etc., or image as a man or father who have forged himself sort of throughout his life, but what they really are spiritually in the depths of their beings. Our essence must take precedence over everything else. Hope this has been helpful. Like and follow for more. Be the light.